Yes.
There should be other people already there. Okay. We can hear them. We can hear them. They can't hear us.
Okay, perfect.
Okay.
That's what I wanted to say.
Okay.
And that's the number. You signed into the ANCC.
Right.
Great. Good afternoon, everyone. How are you? Happy Friday Eve. Yes? Good. Are we ready for this big announcement? What? I didn't hear you. What? Are we ready? Awesome. So you all know that we're Facebook live streaming, right? Susan Mancia and her team and Hector got us all live streaming and ready to go. So I'm hoping all of the units are upstairs and throughout the hospital and throughout our ambulatory clinics are on Facebook and watching us to do that. So we've got about 5 minutes before they're going to dial in. And so we want to make sure everybody understands that when the person comes on, her name is Donna. And so it's not Donna up front who's going to be speaking. It's Donna from Maryland who will probably be on the phone. I don't know if she's truly from Maryland, but she's from ANCC, which is located in Maryland. So how are you feeling about this announcement?
Great.
Good? You guys did a lot of hard work in order to get us to where we are today. And now we culminate today into really celebrating and hearing the announcement of all the hard work you've done over the past 4 years and where we're going to next, right? How many of you all are going to the Magnet Conference next week during the middle of the strike? Good. I'm glad you're going to get away and get to be that. So I want you to have fun and I want you to celebrate. Unfortunately, I'm not going to be there with you. I'll be there the last day with you just to hopefully see some of you to celebrate with you. But I'm going to be here for the strike for Tuesday through Thursday just to support everybody and what they're doing. So I want you to go. I want you to have fun. I want you to not worry about this place and really just celebrate in all the achievements that you've done over the past 4 years in order to get us to where we are today. What kind of comments, questions do you have before we get the surveyor or the board of actually the ANCC on the line? Any comments you want to make about the things you've done?
We're going to get it.
We're going to get it. Thank you. Yes. What else?
Proud to work here.
Proud to work here. Awesome. Me too. You know, I had to share a story with you. I was in chat with Pat yesterday, and I had a nurse who showed up, and her name was, I don't think she'd mind me telling, her name was Jody. She's a relatively new nurse to UCI, and what she said to me was, Pat, I just want to let you know how much of an honor it is to work here. She said, you know, I've been working around Orange County. I've always wondered, you work at UCI. I finally got a position here at UCI. You guys have the resources, you have the people, you have the supplies, and you have the training that we need in order to be a true academic hospital. And she said, it is just such an honor and a pleasure to work here. And a lot of times we really forget how lucky we are here at UCI Health and what we really provide, not only to our nurses and our staff and our physicians, but really to the community, right? And the great care that you all provide every single day. And I want you to remember that every day. Sometimes it's a drudge to come to work, sometimes it's hard to come to work, but I want you to know that every day when you leave work, you have touched a life. One way or another, you have touched a life. And it really came out truly in the story that she told us yesterday. So it was really heartwarming to know that people are coming here because they want to come here and that it's truly a pleasure to come here. I have to tell you another story that we had from another nurse in chat with Pat. We're working on nurse-physician communication, right? And how do we really talk with residents? And you all have to deal with residents every cycle, right? Every 3 years you get a whole new set, right? Every year you get a whole new set technically, but every 3 years you get a whole new kind of cadre. And we're working on how do we really have conversations with our physicians instead of writing IRs, right? So how do we not write an IR about this physician and the physician write an IR about this nurse and we go back and forth, right? It's this quid pro quo kind of concept. And so one of the things we've been talking about, the work group that we've been working on, is how do we really have a conversation. So when a physician comes to us and says, nurse A, you're doing this, 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 and this, or I don't care, or that doesn't mean anything to me, and they make a snide remark to you, how do you have a conversation with them and really set the stage so that you can come to a better agreement? Well, so she talks to us and she said, Pat, I took your advice, and she said, I went down and I saw this physician in the cafeteria, and I went up to him and I said, hey, can we have a conversation? And he immediately got defensive. And so we know that that's going to happen, right? So she said, I was intimidated at first and it took a lot of courage, but I said, can we just have a conversation? And he said, sure. They sat down, they had a conversation, they talked about the things, and she said, remember the day when we had this conversation, you said this, here's how I felt, and I want to know, how can we work together to make that happen? He was still a little bit defensive, but as they talked more and really understood each other, and he really kind of not broke down, but he said, I really wish nurses could follow me to see the 40 patients I have to see every day and the stress that I'm under and everything I have to do. And this nurse said, you know what, we're working on that. And she said, I wish you could follow me and see what I have to do every day for the patients that I take care of. And he said, I would love that. And so they had this conversation back and forth. And at the end of the time that they got together, they were at a better understanding with each other. And she said when she went back to the floor and saw him the next day, they had this different relationship and how they worked together because she had the courage to have the conversation with the physician to begin with and wasn't scared. She was intimidated, but she wasn't scared to follow through with that conversation. And so what it told me is that we have some work to do, and we can all do that. But how do we do that effectively? And how do I empower each of you to have that same conversation with those physicians who maybe give you one of those topics to deal with? So we'll be working on that going forward in the future. We've got about 4 nurses who want to be to continue to work with the residents. And if you want to be on that, please let me know, because I'd be glad to have you on that work group as we go forward to really work with that physician-MD communication back and forth. So kudos to you and the strength that you have each and every day as we deal with physicians to take better care of our patients. So thank you for that. Okay, that's good to know. Any other comments? 1:30. Do we have ANCC on the line yet? Oh, I got to mute. Good afternoon. Do we have ANCC on the line yet? Donna, are you there? Not yet. We shall see. She said she usually dials in right at 1:30, right? Or she may be running. I've got 1:30 on the dot. So, anything else you want to say while we're waiting? A little bit. Yes, Lou.
Since we have the great magnet boards up on each unit, I think it'd be helpful that whenever it becomes available, that our nurses have some clear goals and where we are with that goes out, so we can update our boards with the latest data.
You're absolutely right, Lou. And I've talked to the directors about that, about how do we really get those and keep those updated, right? We shouldn't just do that for Magnet. We should do that all the time so that we can really look at our data on an ongoing basis to make sure we're constantly doing some improvement efforts and where we're going. So, yes, good. Thank you, Donna. Okay. Good afternoon, Donna. Maureen, are you there? Took us off. I did say hello. And good afternoon to all those out there on Facebook Live. Thanks for joining us. And we're just waiting on ANCC to give us a call and see where we're at. And they said sometimes they run a minute or two late, so.
The volume's here, and everything's on here, you're on the line.
Okay. Great. Maureen or Donna, are you there? Okay. I'm not seeing an email from them, so that's a good thing.
Yeah, you couldn't call in on time, so we. Yeah.
Yeah.
So you don't get it.
They just may not be on. No worries.
Welcome to the American. Your passcode has been confirmed. Please wait while you are joined to the conference. Please state your name and company.
Good afternoon.
Thank you.
That is my name. Good afternoon.
Hello?
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 Hi. Yes, can you hear me?
I can hear you. Can you hear us?
I can.
Awesome.
Irvine Health.
This is.
Okay, and am I speaking with Harold Patton?
You are speaking with Pat Patton, yes, Chief Nursing Officer. Now everybody knows my first
Hi,
name. So.
Pat. Okay, well, my name is Donna Haven. Can you hear me well?
I can hear you well, Donna. Thank you.
Okay, well then why don't we begin?
Great.
My name is Donna Haven, and I am the chair of the Commission on Magnets. And I'm calling you today on behalf of the Commission and the Magnet Program office staff, in particular, Maureen Lau, Senior Analyst, and Rebecca Matthews, Magnet Specialist. So the Commission has reviewed all of your documentation and findings from your site visit, and as a result, it is my honor to officially notify you that the Commission unanimously voted to credential UC Irvine Health as a magnet organization for the fourth time.
Way to go! Great news, Donna. Great news. We are so elated. Thank you so much.
Well, you are most welcome, but you earned it. You deserve it. Might I share with you a few exemplars we noted as we reviewed your document?
We would love that.
Okay, so the first one relates to TL3EO, and this is a CNO-influenced positive change that had organization-wide impact beyond the scope of nursing services. The appraisers have previously seen discharge lounges that seem to be passive holding areas for patients ready for discharge. Your organization has adopted a more unique approach in that the discharge lounge is managed by the director for the staffing and patient placement department. As a result, RNs working in the discharge lounge have implemented proactive initiatives to pull patients to the area instead of passively waiting for arrival. They assume accountability for the patients, relieving unit staff, and following through to assure that the discharge process is smooth and the patient is still well monitored. This process provides early bed turnaround time for admissions, especially for ED admissions. This aligns with the CNO's focus on your focus, your focus on throughput initiatives. Nurses and leaders in various meetings talked about this program with the appraisers as being instrumental
Awesome. Congratulations.
The second exemplar related to recognition of a group of nurses for their contributions in addressing the strategic priorities of your organization. The appraisers had the opportunity to visit all 4 of your critical care units. All 4 units were observed to provide exceptional care, as evidenced by quality and nurse-sensitive indicators that exceeded benchmarks. Interviews with staff on these units reflected high levels of engagement and compassion. 3 of the 4 units have received the AACN Beacon Award, the Surgical ICU Gold, the Medical ICU CCU Silver, and the Neuroscience ICU Silver. The Burn ICU is currently in the application process. Congratulations.
Way to go. That's
The third exemplar related to 2 examples you provided of nurses' involvement in interprofessional collaborative practice that ensures care coordination and continuity of care. The ED and the inpatient psych units have a unique and valuable program to address crisis intervention for patients who present at the ED with psych issues. Specially trained ED nurses provide early access and intervention for mental status evaluation of ED patients within 1 hour of arrival. The nurses provide crisis intervention in conjunction with ED and psychiatric MDs. Outcomes from April 2017 through March 2018 included evaluating 65% of mental health patients within 1 hour of arrival at the ED, successfully diverting 71% of these patients from inpatient hospitalization and linking 59% of these patients with outpatient mental health care. Congratulations.
Way to go.
The fourth exemplar relates to an improvement that resulted from an innovation in nursing. Working with the UCI Patient Experience Learning Consultant, clinical nurses from DH 4858 developed an innovative, interactive, simulation-based experience to allow nurses and nursing assistants to see how a patient might see them during an interaction. Utilizing an education program entitled Reflections, staff were able to reflect on videotape simulations and provided coaching to improve their interaction with patients. The success of this initiative on DH 4858 resulted in a rollout to other units. Enculturation was clearly evident with improvements in HCAP scores in communication with nurses in the top box percentage. Congratulations.
Way to go.
And finally, are you ready for a 5th exemplar?
We are ready.
Okay, this related to examples you provided of an improvement that resulted from an innovation in nursing. The education team on the oncology unit developed a Scrub the Hub method called 1, 2, 3, Count With Me, involving teaching patients and families to count to 10 with them when a hub is scrubbed. This involves nurse, patient, and family collaboration and enhances accountability of the nurse to provide consistent, standardized care. In one of the scheduled meetings, a physician who had a lengthy hospitalization described the process and voiced his pleasure at the consistency with which it was followed. After implementation, the oncology unit went 525 days without a collapsing. Patient engagement in their own care has driven the organization to implement this method hospital-wide. Congratulations.
Way to go, 6678.
So, in conclusion, UC Irvine Health, is now one of 36 magnet organizations in California. This accomplishment is clearly testament to your commitment to nursing excellence, to supporting the entire healthcare team, but most importantly to the patients and families you serve. So we hope that you'll be attending the Magnet Conference in Denver next week. Will you be there?
We will.
Well, we look forward to celebrating with you, and I would personally like to meet you and all of your good friends. Will all of your best friends in the room be there?
A portion of them will be there, Donna, yes.
Well, good luck to you. Now, is there anything you or others might like to say before you celebrate?
Well, I'll start, Donna, and I'd just like to, give a huge thank you to our Magnet program team. So Donna Grokow, Charlene Miranda Wood, and many of the educators, CNSs, others, all of our nurses who provided information to really write the document and spent countless hours to do that. Our nursing directors, our nursing managers who provided support, but as well as our physician colleagues, our rehab colleagues, our radiology, all of those people really surrounded us with love and support as we got through this Magnet process. And we continue to have a continuous Magnet process to make sure that we are the best of the best in Orange County, and we really feel like that as well. It's a huge honor and pleasure that we do that. We created some Magnet ambassadors across the organization that have really led us to really help us get prepared, and they were really the crux of making sure. They were the staff who really led us to success to do that. And Donna, I can only say that kudos to your leadership, because the 3 appraisers that we had on site were just more than delightful. Yes, they held us to the standard, but really were just wonderful to work with the days that they were here, and it was just such a pleasure and honor to work with them.
Excellent. Anyone else?
And one thing I had to say, Donna, our CEO is a nurse himself, and he has a strong passion for nursing. And without his support, our CFO, our CMO, who's my dyad partner, our CAO, just have really surrounded us and given us support from the executive level that we've needed in nursing to really make sure that we've succeeded. So I want to make sure that I thank them as well.
Well done. Excellent to hear. Anyone else, or are you ready to celebrate?
Anybody else? They are ready to celebrate, Donna.
Well, please make sure we meet next week, and I'd love to meet you and all of your friends who join you.
Wonderful. It's a pleasure speaking with you.
Okay. Pleasure speaking with you, and congratulations to all of you. See you next week.
Great. Thank you again.